Retinal vein occlusion means that one of the major blood vessels that draw blood away from the retina gets blocked. Now you can have two types of vein occlusions. When the major blood vessel is blocked, it is called central retinal vein occlusion. Smaller branch gets blocked, then it is called a branch retinal vein occlusion. The most common cause for retinal vein occlusion in an older individual above 50 years is the presence of systemic hypertension, that is increased blood pressure in your body, or presence of diabetes. These two things are the commonest risk factors that we find. In a younger person who is less than 50 years who does not have associated hypertension or diabetes, vein occlusions can be caused by a lot of other conditions. Some of the conditions which cause them are raised homocysteine in your blood, autoimmune conditions like systemic lupus erythematosus, then you can have some hyperviscosity syndromes. In an older individual, sometimes you can get conditions like multiple myelomas or leukemias that are causing these vein occlusions. Retinal vein occlusion is a catastrophic event in the eye. Because of that, it is usually very symptomatic. It causes sudden, painless decrease in vision in the eye. And usually the patient will notice that there is a drop in vision, and sometimes it will be on waking up in the morning, but it can occur during other times also. Central retinal vein occlusion is very symptomatic that way. Branch retinal vein occlusion can cause a sudden drop in vision if it is involving the macular region that is needed for vision. If the branch is supplying some other part of the retina, sometimes it can be asymptomatic and may be noticed only when there is a dilated retinal examination. There are no tests required for diagnosing retinal vein occlusion. A retinal vein occlusion is a clinical diagnosis that is made by a dilated retinal examination by either a retina specialist or an ophthalmologist. But once it has been diagnosed, we need to do a few tests to find out how much the vein occlusion has affected your retina. One of the tests that we do is called the fluorescein angiogram. This will assess how much blood flow into the retina has been affected by this occlusion. So we inject a dye called sodium fluorescein into the vein of the hand, and then we take pictures of the retinal vasculature. This will tell us how much the block has affected the capillaries and how much blood flow overall in the retina has been reduced. Then we also do a scan of the retina called optical coherence tomography. This tells us how much macular edema has occurred because of the damage during the retinal vein occlusion. These two tests will help us assess the damage and then plan the treatment. For retinal vein occlusions, the treatment is required in two stages. One is to find out why it occurred. So your doctor will probably send you to a physician to assess whether you have hypertension or if you have diabetes. If you have these two, whether these two are controlled or not. If you do not have them, to find out if there is any other cause of the vein occlusion. This investigation will be needed much more detail if you are a young patient, if you are having your vein occlusion when you are much lesser than 50 years. After we find that out, along with that we also need to do the test for the eye, and once the tests are done, treatment is given for two things. One is to reduce your macular edema, and secondly to prevent further complications. The reducing the macular edema usually will cause an increase in visual acuity, or your vision will improve, but for that you will require repeated treatment. The treatment for macular edema is to give intravitreal injections, where injections of an anti-VEGF agent or a steroid are given into the vitreous or the jelly of the eye so that the medicine reaches the retina or the macular area. This will cause reduction in the fluid content of the retina, and that will cause a corresponding increase in the visual acuity. However, some of the vision loss that you have occurred due to vein occlusion is because of the decrease in blood flow. That cannot be corrected all of a sudden, and therefore some residual decrease in vision will happen. Along with this, another problem is that the injections that we give, the anti-VEGF injections, will last only for a month or 6 weeks. So if the edema is not fully reduced, or if the edema is coming back, then you will require multiple intravitreal injections. To prevent further complication, we also may need to do some laser. That complication is the development of new blood vessels. So to prevent new blood vessels from occurring either in the retina or in the black part of your eye called the iris, the doctor may advise that you need to undergo pan-retinal photocoagulation or a retinal laser. So these are the two modalities of treatment that we need for vein occlusions. Retinal vein occlusion is a rather dangerous disease, because if you do not treat it on time, if you let the macular edema be there for a long time, it will cause damage to the cells that are needed for vision, and it will irreparably damage the photoreceptors. You can also have long-standing macular edema damaging all the layers of the retina, such that even if you treat it at a later date, you will not regain much vision. You can have a membrane formation over the retina, you can have partial thickness hole formation. All these things happen in the macula if macular edema is not treated on time. The decrease in blood flow to your eye can cause a long-term complication called neovascularization, which means new blood vessels can arise. In a branch vein occlusion, we most often see this neovascularization in the retina, and they will cause sudden loss of vision by bleeding into the eye. In a central retinal vein occlusion, these new blood vessels are commonly seen on the iris or the brown and black part of your eye, and that can cause rise in intraocular pressure called neovascular glaucoma in the future. So these are the long-term complications of vein occlusions, and vein occlusion is something that needs to be treated in time for you to get maximum result from it. Since the most common cause of vein occlusion is diabetes and hypertension, control of both these entities can to some extent prevent retinal vein occlusion. Regarding the other causes of vein occlusions, because they are not so common and because they are not preventable, sometimes they are recognized only when the vein occlusion occurs. But even if it does, treatment on time can surely save your vision.